or to have treated. And not a single one of them is pain. And as I said 2 days ago, you just have to trust me, the rest of the letter was not like pain, 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 pain. It wasn't. It was talking about the ways that pain had fundamentally impacted her life in the negative. This fundamental impact in the negative is something that Fordyce 40 years ago called suffering. And Fordyce said pain and suffering are different. Suffering is the impact of pain on the lives of people who are experiencing it. Here's a model of pain and suffering, and it's not a very clever model. The model is this: pain leads to suffering. Our patients know this model. If you want to test this model later, I'd encourage you, if you see a small toddler walking along the street or something like that, go trip them and see if pain does indeed induce suffering of some sort. And the point here is our patients get this. They get it. Pain's screwing up my life and it's leading to suffering. If I can just get the pain down, then I ought to be able to get the suffering down. And that model is absolutely accurate if we can get pain down. But I've just spent 10 minutes talking about how hard it is to get pain down. Our patients know it. This is some data we published a long time ago. It was a questionnaire development study where we were trying to assess degree of pain willingness or pain unwillingness in people. One particular item, it's important to keep fighting this pain, struck us as odd in many ways because the overwhelming majority of patients, 92%, said always true or almost always true, the two highest levels of endorsement. It is important for us to keep fighting this good fight. From a psychometric or questionnaire development perspective, this is a bad item because there's no differentiation between people who are filling it out. Everybody's saying it's important to keep fighting this fight. And the only problem with fighting this fight or struggling for pain control is that it seems to be a very reliable predictor of trouble. The more time people spend in their daily life struggling for pain control, the more disrupted their life seems to be. It's another questionnaire. It's called the Brief Pain Coping Inventory 2, because we thought it was clever to name the second one too. And it assesses a number of ways of responding to pain. It asks people, out of the past 7 days, how many days have you engaged in these kinds of behaviors in response to pain? And it's a mix of kind of positive behaviors or things that we would think are good, a mix of negative behaviors or aversive behaviors. And one of them is, how many days out of the past 7 have you struggled for pain control? And at an item level of analysis, that single item is the best predictor of functioning that we found across all of these different ways of functioning, such that if individuals were spending most days out of the week struggling for pain control, they reliably have worse pain, poorer activity, greater levels of disability, greater depression and distress, more pain-related fear and avoidance, more pain-related healthcare utilization. And we've investigated this across time and situation, so it has longitudinal value. We've assessed it in adolescents, adults, and older adults. We've assessed it in primary care and tertiary care, maybe in a few other ways we've assessed it that I can't remember right now. In other words, it seems to be one of these findings that is reliable. The more time people spend struggling for pain control, the worse off they tend to be. And so it's not that this model is wrong, it's right. It's that this model might not quite be adequate when it comes to the treatment of chronic pain. And a more adequate model might look something like this. I'll walk you through this in a moment. If you've spent time with psychologists, you'll know that models that only have one arrow make us incredibly nervous. And so I don't know if this is a better model or not, but gosh, it's got more arrows, so that makes me feel a little bit better. Anyway, you'll see that we got pain and we got suffering, right? This is hard to do. We got pain, we got suffering. But down in that lower circle, we have responses to suffering.